protect our head. The other way is that we want to protect our hearts, and we want to reduce inflammation as much as possible. What if I told you that there is a magical solution or a magical pill that can help with that? So without further ado, just stay tuned and I will explain what this pill is and other things associated with it. So stay tuned with Dr. Mohammad Almoataz. So what are omega-3s? Omega-3s are a type of essential fatty acids, meaning that your body needs them for it to function properly. And it is not usually made in the body, and it's something you acquire from the outside world. It exists in three types. Number one is the ALA. And the second one is the EPA. And the third one is the DHA, which is the most common, and you've probably heard of it. So these all exist within different types, and I will link a picture here as to where you can find each and what foods are associated with them. So what is the mechanism of how this works? Obviously, with anything, you will always ask, how does this work? So omega-3s are essentially built into cell membranes, making them very flexible and improving how a cell communicates. They also produce anti-inflammatory responses, and they also produce what we call protectants. These help protect your cell membranes and improve the outcomes of whatever cell is using them. And these protectants are essentially why omega-3s are highly effective. With regards to omega-3, it has almost 6 very good things. Number one, it protects your heart. How does it do that? So it usually lowers the triglycerides in your body, and it improves the HDLs, the high density lipoproteins, which are essentially increased during exercise and are called the good cholesterol. And it reduces the risks of arrhythmias, believe it or not, which is an abnormal heart rhythm. Then after the heart, you move on to the brain. So with regards to the brain and mental health, they've noticed that the third type, the one I've mentioned, the DHA, actually supports memory. And the second type, that the one I mentioned, the EPA, helps with mood and depression, and that's how it protects the brain and the mental health due to the anti-inflammatory effects and the aforementioned protection mechanisms. And then you move on to the windows of the brain, the eyes and the vision. It is very important for the retinal development. So the retinas are essentially what benefit mostly from the omega-3s. For them to function properly, they will require something essential such as the omega-3. And then you have the anti-inflammatory effects, which is helpful in diseases such as arthritis, asthma, autoimmune diseases. And if you're highly athletic and you cause yourself to suffer from inflammations, this will help you with that. And number 5 is for you pregnant women in general. It helps with pregnancy and childbirth, and apparently it is very important for the fetal brain to develop. And finally, your general well-being, how you look, your skin, your hair, and your general appearance. Now that we've touched on the benefits, we want to move on to the needs and the uses of omega-3. So who actually needs omega-3? Number one is if your nutrition is lacking, such as if you're not having fish for a diet, for example, and if you don't have it minimum of 2 to 3 times. And then if you're pregnant, this might help with the fetal development, because when your body is pregnant, you usually use over from minerals and vitamins. Therefore, you might require more of it. And then people with high triglycerides. That's a mouthful, I believe so. Okay, those people usually benefit, and we use it as a therapy for that, believe it or not. Now, with any medication or pill, usually you want to ask these questions. When is it contraindicated? When are we not allowed to use it? People with bleeding risks usually avoid taking omega-3s because high doses of it can lead to bleeding disorders, especially when used with a medication we call warfarin. And then you have people who have GI upset and people who usually have halitosis, which is a bad breath of the mouth. Okay? And people who are allergic to fish, obviously, those people will also avoid it. I, for one, love salmon. Okay, so a quick recap on it. You probably noticed from all I've mentioned is that omega-3 generally is a very good drug unless you have a bleeding disorder or experience GI upset, which is basically stomach pain. However, generally it helps with the bones. That's essential as you grow. It helps with the brain. That's more essential as you grow. Your heart, it protects the heart, and that is the most important organ. The beating is what keeps you going. Now, if you've liked the contents of this video, please subscribe and press the bell for more videos and like this video. Stay well.